Well, this is the month where you see pink. It's Breast Cancer Awareness Month, and we've got some newer technology to tell you about at Mercy Health St. Rita's. Joining us today, Department of Radiology Director, Dr. Nicole Nelson, and to tell us more. And thanks for coming.
Hi, great. Thanks for having me, Holly.
It's good to see you. So, okay, so let's just say October is the awareness month, but we want mammograms throughout the year, right? And mammograms are the first tool, right? A first way to be able to try to find cancer if you have it.
Absolutely. So every woman beginning at age 40 needs to come in and get their mammogram every year.
Okay, every year. Is there a cutoff, like, once you reach 80 or something like that? Or
there are no cutoffs. So what I tell people is when it gets too difficult for you to get here, that's when you can think about stopping doing your mammograms. But we have women, in their 90s. They come in on the iciest, coldest days, by the way, not like the 85 degree weather we're having now, but they never miss.
All right, very good. Okay, so that's the start. And sometimes when you do a mammogram, you find that some women have dense tissue. So what does that mean for you as in your department looking for cancer?
Yeah, so recently the FDA has come out with a mandate that women with dense breast tissue, we are required to inform them. We do that at the time of their mammogram as well as via a letter. And you're supposed to talk to your doctor about what else you're supposed to do. So women with dense breast tissue are at a higher risk of developing breast cancer than women with fatty tissue. And so now we have new technology at St. Rita's to aid in detection and seeing through that dense breast tissue, and it's called ABUS, or automatic breast ultrasound.
Okay, so like when you're reading then the mammogram, it's hard for you to look through that tissue then and see from a normal mammogram?
You cannot. So there are some of these, and so some people will say that, oh, the mammogram missed my tumor. And those tend to be people with dense breast tissue, and we just can't see through it. But the ultrasound machine is excellent at it, particularly when with women with that breast density.
Okay, so you said ultrasound, so does that mean it's not the flatten yourself with a mammogram? How do you do this test?
It is not. It is a detector that's 15 centimeters, so it's about this big, and it goes on someone's breast, and there is a little pressure, and it's computer, AI assisted, and it makes pictures in 3 different planes so that we can see through all that breast tissue. And it's amazing technology. It's been really exciting to be able to bring that to our community.
Right, yeah, because I mean, you look at all the different ones, so this really is eye-opening maybe sometimes for you guys when you first saw this?
It is. When we did the training on it, because I have been out for quite some time, and so it wasn't something that was available when I was in training, and so you do your training. It's really exciting. And I have to give a shout out to someone from Ottaville. Tim Rieger is our financial guy at St. Rita's. It's hard, things are expensive, and he really went to bat for the women in this community to get this technology so that it's available for them.
All right. So when you get that letter or you tell us that you have dense tissue, how is it that we can arrange it, and is it possible then to get this new technology?
So if you're interested that day, our staff can arrange and do your mammogram and your ultrasound on that day. They do have to call your doctors to get an order, but we have that all kind of pre-set up in the background. We can send it electronically through the medical record, or we can fax it over. Or if it's something you're interested in, call our department. We can get it scheduled. Same thing, we can assist with the order because we have the right codes and all the information that you have to get that through.
You said that you've been out of town in places recently, and it was nice to know when you're meeting with doctors from all different places that Lima's on top of it, right? We're doing good?
Absolutely. I was doing I was actually training other physicians on how to do breast biopsies, and I was working with a women's imager from Boca Raton, Florida, who had this, $1 million breast center, and someone else from Louisville, Kentucky. And the 3 of us ladies were talking about, what do you do? What do you offer? And we have some services that we can offer in this community that they don't even have down there. It was really exciting to listen and talk to and learn some things from them. They learned some things from me. And so it's great to have that exchange of ideas and realize that we do a fantastic job in this community taking care of our patients.
And so the first step is, though, to get the mammogram. Get started, right?
You got to come, you got to show up, you got to get your mammogram.
All right. Thank you very much for coming today, Nicole. Good to see you.
Thank you.
All right, don't go away. Noon Edition will wrap up after this.